Hawaii has hit a major milestone in the fight against COVID-19. More than half of the state's population is fully vaccinated, and an even higher percentage of residents have gotten at least one shot. But with the pace of vaccination slowing, can we still reach herd immunity? And if so, when? We'll get a progress report, plus talk about what's legal, what's safe, and what's right when it comes to vaccine requirements. Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Yanji Denise. As of today, Hawaii has administered nearly 1.6 million COVID-19 vaccine shots. That's about 54% of our population. While Hawaii has one of the highest vaccination rates in the country, demand for shots has been dwindling, and the Department of Health has been ordering fewer doses. Will vaccine hesitancy threaten our chance at herd immunity? And what are the legal ramifications for vaccine mandates? We'll ask our panel tonight. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and on the PBS Hawaii Facebook page. Now to our guests. Hilton Rathel is the president and CEO of the Healthcare Association of Hawaii. The nonprofit represents 170 healthcare organizations, including hospitals, skilled nursing and assisted living facilities, and hospices. Lola Hiroko Irvin is the administrator of chronic disease prevention and health promotion at the Department of Health. The division works to promote wellness through prevention, detection, and management of chronic diseases. Jessica Gasorik is an associate professor in the communicology department at the University of Hawaii at Manoa. Her research looks at how people process messages, adjust their communication for different contexts, and how social identity affects communication. And Ron Brown is a professor at the William S. Richardson School of Law. His teaching specialties include labor and employment law, employment discrimination, arbitration, and U.S.-China labor and employment law. Now, before we get to our discussion tonight, we want to lay out some benchmarks that the governor has laid out in his vaccination plan. Starting on June 15th, inter-island travel restrictions will be lifted, and passengers who have been vaccinated in Hawaii can bypass quarantine without a pre-travel test. At the 60% vaccination rate, passengers traveling domestically can skip quarantine with proof of vaccination. Social gatherings can increase to 25 people indoors, 75 outdoors, and restaurants can operate at up to 75% capacity. When the state reaches a 70% vaccination rate, all travel, social gathering, and restaurant restrictions will be lifted. Hilton, I want to start with you. I know this is something your organization obviously has been tracking. How soon do you think we could get to those benchmarks laid out by the governor, those 60 and 70%? How realistic is it that we'll get there anytime soon?
Well, these are very aggressive benchmarks, and as you just mentioned, we have, as of today, almost 1.6 million doses administered. To get to 60%, we need 1.73 million doses. To get to 70%, we need over 2 million doses. So that means, as of today, we need 138,000, almost 140,000 doses to get to the 60% level, and we need over 400,000 doses administered to get to the 70% level. You also mentioned that the demand has dropped off fairly dramatically over the last 2 to 3 weeks. We do not know yet. It's too early to see how much of an impact these incentives will have. We are hoping that they will have an impact, but at the current rate, in other words, in terms of what we have been doing just over the last week, it would take another 4 weeks to get to the 60% level if we maintain the last week's vaccination rate. And again, at last week's vaccination rate, it would take us 12 weeks to get to the 70% vaccination level. So it is doable, but again, it is a very aggressive target because it does require, because there's 255,000 children between 0 and 11 years old in the state of Hawaii that are not eligible for the vaccine right now. So we need over 80% of the population 12 and older to be fully vaccinated in order to hit these thresholds. And that is an aggressive target.
Aggressive, definitely. Do you think it's unrealistic?
It's possible, The question is, when will we get there? Hawaii has done incredibly well as a state. Going back to March 7 of last year, which is when statistics started being collected across the nation, and through the end of last week, Hawaii has the lowest infection rate in the nation and the lowest death rate in the nation for the entire measurement period. And that's something we should be incredibly proud of. We have just over 500 deaths. I believe it's 505 deaths. If we had the death rate of the highest state in the nation, we would have over 3,500 deaths to date in the state of Hawaii. So that's an incredible difference, the difference between the death rate we have, while tragic, and the death rate we would have had if we had the death rate of the highest state in the nation. So again, we've done incredibly well. When I go out and walk around, when I was walking around downtown Honolulu today, and there's mainly locals walking around downtown Honolulu, so I'm not talking about Waikiki or Ala Moana, but downtown Honolulu, there are more people wearing masks than not wearing masks still in the state of Hawaii, even though that's no longer a mandate. So again, our state has done incredibly well. It is possible, but it is also challenging because to get to over 80% of those 12 and older vaccinated, when you know that there's a certain percentage that either can't get the vaccine for either religious or medical reasons or won't get it, and there are others who just don't want to get it. And so it's a possible target, but it's also a very aggressive target.
Lola, I wonder from the Department of Health standpoint, who's not getting the vaccine? Where are we seeing the largest pockets of vaccine hesitancy, and what can be done to reach these communities other than the incentives that the governor has laid out?
Okay, so I'm going to start with what can we do? And so we're doing community outreach and public education. And so in terms of why they're not getting it, it's a matter of access, right? And access takes many forms. It may be access to correct information. Access may be an issue of transportation, geography, work. Does their workplace allow them to take time off? Are they hourly? Do they have childcare? And so we're learning, working with community partners, and of course with the Healthcare Association, in terms of just working together to find out what those issues are of access so that we can be there, which means things like this weekend, in terms of being at Wet and Wild, being in faith communities and churches, having pop-ups. So you saw some vaccinations happening at shopping malls. So it is also a matter of understanding why people haven't been vaccinated. And a lot of it has to do with access. Sometimes in terms of information, some people had thought that if they didn't have insurance, they couldn't be vaccinated. So it's overcoming that, and in the languages they need it. So I think Jessica probably has a lot of that information too from the communicology expertise. And we are also working with community partners to understand what those needs are.
Well, Jessica, let's talk about that. Oh, please go ahead.
Can I ask Lola a quick question? Do you have access to the prisons?
Yes, we do. And we have actually trained the public safety department in terms of the testing, and also then help them with the vaccination.
Jessica, I do want to get to you. I know that your team has been studying, the issue of vaccine hesitancy. What have you learned?
So we've been looking at what's called the PULSE data. This is data that's collected by the U.S. Census Bureau. At the start of the pandemic, they started doing basically biweekly surveys, and they've been doing them all the way through. Starting in January of this year, they started including questions about vaccination, asking people if they've been vaccinated, and if not, their likelihood of getting the vaccine. And if that basically wasn't something like, yes, I will definitely get it, then the reasons why they were hesitant. And so that's given us a little bit of a window into the reasons that people are hesitant about getting vaccinated. And that in turn sort of can be a starting point for messaging or outreach or things like that around that. So what we're seeing basically is, there is, as Lola mentioned, there's a subset of people that say, I want to get the vaccine, but even now when vaccines are widely available, still haven't. And so that's very likely access issues. The Pulse survey itself doesn't break down questions about access, but when you look at somebody who basically says, I definitely want to do this, but they still haven't months into something being widely available, I think you really have to be looking closely at access, and that's a really important issue.
Aside from, sorry, please go ahead. Yeah, aside from access, what are some of the other reasons that people have laid out for not wanting to do this?
Yeah, so as I say, for the folks who don't say, I definitely want to do this, but are expressing more hesitancy, we sort of see it falling into two categories at this point. So based on the most recent wave of this data, which goes through basically May 24th, there's a little bit of a lag in terms of reporting. Safety continues to be a major consideration for people. For folks who say, like, I'll probably get it, or I'm not sure, concerns about safety are their number one reason for not doing it. When you start to move into people who express stronger hesitancy, so people who say things like, I probably won't get vaccinated, those folks start to also believe that they don't need the vaccine. So it's not just a question of, I'm going to wait and see if it's safe, but rather, I don't actually think this is something I need. And particularly people are saying they don't think they're a member of a high-risk group. So this group tends to skew younger, as you might guess. And also people in that group are saying they don't think COVID is a serious illness. And so people are sort of looking at this and saying, this is not something I need. On the very end of kind of the most extreme part of the hesitancy scale, we've got folks who are saying they're definitely not going to get vaccinated. And within those groups, the reasons tend to be things like they don't trust vaccines, they don't trust the government, in addition to not thinking that they need it. So at that very far end, we start to shade into another set of issues.
Given all of those groups, will there be enough people that you can capture and convince to get us to the thresholds that the governor has laid out?
I think in terms of what Hilton had said, we are seeing a really rapid uptake with the 12 to 17-year-olds. So that's looked really good. And in fact, the 12 to 17-year-olds may catch up to the younger adults, like Jessica had talked about. The younger adults tend to be those who are waiting. In terms of economics, also drive their decision. And so I think in terms of what's happening now with all the business sector and the healthcare sector, looking at the issue of kind of a challenge and scarcity with all of the external motivators, I think that may really help that, the younger age group, because they also want to gather. So what are they missing out on? And they also are motivated by, economically, we're having a hard time. And so with these external incentives, I think it may help them. And so I think the private sector is doing a fantastic job in terms of addressing those issues that the younger adults are saying are important to them.
There is one other factor that is impacting some individuals, and that's the fact that the vaccines right now that are available have only received emergency use authorization by the FDA. And so there are some individuals who have said, well, look, I'm going to wait until there's full authorization. Now, we expect that will happen hopefully in the fall. So it's not that far off, but we believe that will be a motivating factor for a number of individuals. But the question is, can we get to those targets? We'll get to the 60% target within, relatively soon, but the 70% target is going to be more of a challenge. And it may require some additional incentives or additional motivating factors, such as the full authorization, or schools, for example, requiring vaccinations, or other employer groups requiring vaccination. But I would absolutely echo what Lola just said about young people. The 12 to 17-year-old age group, and they've only, especially the younger ages, 12 to 15, have only had access to the vaccine for a relatively short period of time. There's almost 40% of those individuals in the state in that age group that have received one or more doses. And that's very, very encouraging. There's a lot of young people showing up. The mobile vans at Hawaii Pacific Health, Queens, other organizations are taking out to the school. And we appreciate the incredible collaboration with the Department of Health on all of these initiatives. That is really helping. And what Jessica was talking about in terms of providing access, we are finding that we have to, and a lot of the early adopters have just made the decision. They've jumped in their cars, they've driven to Pier 2, they've driven to the hospitals on the neighbor islands, they've driven to the Blaisdell. But now we've got to take the vaccine to them. And it's a convenience factor. A lot of people are busy, they're stressed, they've got all sorts of things going on. There are mobility issues. There's a whole bunch of reasons that Jessica talked about. And so we have to take the vaccine to them, and it is having an impact.
Ron, let's talk about what Hilton just referenced, which is this idea of possibly having more mandates, if you will, not just incentives, but actually switching from the carrot to the stick. Where do we see that going legally for the state? I know that the University of Hawaii has set out that had said that anyone basically on campus is going to have to do that once the FDA gives full authorization. Do you see other employers adopting that, and legally, how can they do that?
I've seen a couple of, in the newspaper, a couple local employers have mandated it. The law is fairly clear, I think, in my view, that a mandated vaccine is perfectly legal. It's been okayed by the Supreme Court for 120 years. And school kids have vaccines. You can't go to school unless you have a vaccine. And it's in the interest of the greater good to have a smallpox vaccination. And that trumps the individual right to be free from a vaccination. So as Hilton, I think, mentioned, there are a couple limits, legal limits to that constitutional case, and that comes generally from statute, Title Civil Rights Law 64. Religion and disability can provide a basis for not getting the vaccination. However, as you get into the evolution of that law, the EEOC, as has been mentioned, says that there's no reason why you can't ban it. But if you have a disability or a medical condition or a religious conviction, the obligation of the employer is to reasonably accommodate without undue hardship. So if the employer cannot reasonably accommodate without undue hardship, then the employer wins. Reasonable accommodation could be remote work, etc. Incentives, as long as they're not coercive, are okay. Presently, there's no federal mandate, so it's left to the states are allowed to look out for the public welfare. So a few of the states have been banning mandatory vaccinations for certain employees. I personally think it's likely unconstitutional. It's one thing, I think, for the states to look out for the public common good. It's another thing to pass laws that would tend to undermine it and allow the spread of the vaccine. So one of the arguments I didn't hear Jessica mention was maybe it's a Southern argument. It's my right. I don't have to get a vaccine if I don't want to without my consent. So legally speaking, yeah, that's right, but they don't have a right to a job either. So they can either get a vaccination or no job. I would like to, the reason that a mandatory vaccine might be a good thing, in some cases, for some employees, hospitals, nursing homes, prisons, places like that. There was an article in the local Hawaii newspaper a couple days ago. Let me just quote it. It said, 38 infections were linked to an Oahu fast food restaurant, beginning with 11 unvaccinated employees, spreading to 27 of their household members, 4 of whom worked at 3 other fast food restaurants, where 7 more cases were confirmed. So that's the kind of thing you're trying to avoid. And if you can cut it off by mandating vaccines at the employment level, why not? It's for the common good.
Hilton, what are you seeing among your members? Are there hospitals and healthcare associations that are starting to adopt any kind of mandatory vaccinations for employees?
This is an issue we have been discussing for a number of months because we knew it was coming up. In Hawaii, the association has not taken a position at this point in time. We're actually in the process of surveying all of our hospitals right now to get a sense of where they're at. We're very fortunate that we have very good vaccination rates among staff in our hospitals and even higher vaccination rates in our nursing homes. So we have well over 80% of the staff in our nursing homes vaccinated and over 90% of the residents. So we're doing very, very well compared to national averages or national benchmarks. In regard to the mandate, one of the challenges that our members are facing is that, and I agree with what Ron said in terms of what the law says in regard to flu vaccines, smallpox, tetanus, things like that. What has not been litigated in the courts is vaccines that have been approved under emergency use authorization. In the US history, there's only one other vaccine apart from the COVID vaccines that have received emergency use authorization, and that is for Ebola. Now, fortunately, Ebola was not widespread in the community. It did not become a pandemic. So that was never litigated because employer groups were not mandating the Ebola vaccine. So there is the vaccines that have been approved under emergency use authorization. Again, the only other one is Ebola. And now we have the 3, Pfizer, Moderna, and Johnson & Johnson. So that has never been tested in the court as to whether a mandate can be in place for a vaccine authorized under emergency use authorization. However, I do agree again with what Ron was talking about the public good, especially in hospitals, nursing homes, prisons, places like that, and potentially even in restaurants and hotels where you've got a lot of interaction between staff and the public. And so we as an association are very supportive of vaccines. We have been working across the state for months in very close collaboration with the Department of Health and many other organizations to vaccinate as many people in Hawaii as possible. I anticipate, because many of our hospitals in the state already have vaccine mandates for things like flu vaccines, for example, and you have to be tested for tuberculosis. So that's all mandatory. That has been well litigated, as Ron mentioned. So, but I believe that once there is full authorization for these vaccines, which we expect this fall, that many organizations, healthcare and other, will go ahead with mandates. But that's something that they are concerned about, the emergency use authorization and the fact that it has not been litigated in U.S. courts.
Jessica, I want to hear your thoughts just on how this would get rolled out. The concern would be that if you mandate something like this, there could be people that dig in their heels even more. And we've heard politicians, throughout the pandemic, the lieutenant governor and the governor say, we're not forcing anyone to do this. They've been very careful with their language and saying that this is a voluntary decision. If that starts to change and it does become more mandatory, how do you think that will be received, particularly in the populations that you've been interviewing?
I think it's going to be a mixed response. Already you can see the discussions of people who are kind of up in arms about the possibility of there being mandates, and that's before they've rolled out at all. When we did a report back in March and mentioned the possibility of mandates as a step that could be taken hypothetically at that point, when vaccines were widely available and other sort of avenues had been exhausted. And that was a point that we got a strong response back from individuals, contacting us who were not happy with that idea. So I think you are going to get pushback. At the same time, I do think the framing of it matters, and I think the communication about it matters. If you're going to roll out something like that, obviously it needs to be communicated well ahead of time so people have the opportunity to make plans, to take steps, to go and get the vaccine, despite what other challenges they might have, like arranging childcare or getting to a site, or having the opportunity for someone to come to them, or those kinds of things. And so I think if you get to the point of that rollout, communication about the timeline is going to be critical. Giving people enough time is going to be really important. And then making clear, who it applies to, who it doesn't. Is there a process for exemption? Those kinds of things. But I do think your point, that you raise is important, is that we have had a narrative so far overall that has kind of positioned this as a personal choice. And so if we shift towards there being, more widespread mandates, that narrative is going to have to change, and I think some of the things that have been discussed here about framing it as, this is for the public good. This is, something that's, in the end, it's not an individual thing, because we are all living together in a society in an interconnected way. We're interacting with each other. And so this can't just be, you as an individual get to do whatever you want. I mean, we have we have lots of different things in society, in addition to vaccines, where we've sort of made social agreements that this is how things are going to work. If you're going to drive a car, you have to have a driver's license, you have to have insurance, you have to follow the rules of the road. And that's done for the collective good. And so I think there are certainly ways to frame it that could potentially allay some concerns. But it will require a shift in narrative, because it has been a very sort of individual focused approach so far.
So Jessica, let me ask you a quick question, if I may. So assuming the vaccinations lose their emergency status and they become permanent, how would you distinguish between a COVID shot and a TB shot? I remember I couldn't work at UH unless I had a TB shot. So why not a COVID shot? Why not a smallpox shot? I mean, does that take away the arguments?
I would say that oh, go ahead, sorry.
No, some of the arguments. I know it doesn't take away the some people's rights.
Yeah, I mean, I think there are some people who would object, right, to the TB test or to the TB shot or to other things. I mean, there are subsets of the population that are going to push back, even if you point out that it's very similar to other things. But I would agree with you that once we're in that full authorization phase, I mean, I think you can point to analogs that are that are sort of readily available, and those comparisons, sort of do become available, and I would hope would be compelling. I think the major difference for people who may still be concerned about safety is, a lot of these other things have decades of track record behind them, right? Smallpox vaccines we've had for a long time, TB for a long time, MMR, all of those kinds of things. And I think people are still looking at COVID vaccines and thinking like they're new, they were developed really quickly. We just don't have the same track record. And so I could see that being a potential point of pushback. But I do think that making those analogies is potentially helpful if we have the full authorization and we're able to do that.
I want to get to some of our viewer questions. Lola, Dave in Kapolei asks, and another person on Facebook is saying, this whole question of herd immunity, and, we've been so fixated on this from the beginning to get to herd immunity. Is there really herd immunity? Seems like a carrot that keeps changing. And then and Dave says, is herd immunity realistically achievable? Is this idea of herd immunity, is this a goal that we should continue to strive for? There are some experts I know on the national level who say that the U.S. as a whole, perhaps not Hawaii, may not actually get there, and that shouldn't be the focus.
Yeah, and I think Hilton touched on that, right? It depends. And so in terms of the 70% goal, it's a tough target, but it is achievable. But I think the definition of population-based immunity has not been defined for COVID-19 and the vaccines we have. And so it would be premature for us to say, yes, there is a number we can pin immunity on. And because also there are variants, and we are finding the vaccines that are available are very effective. And so I think it's more a matter of what we do now in terms of the campaign, so we can stem and we can stop the transmission of the disease. Hilton made a good point in terms of walking around downtown, and I think Jessica's pointed to that too, in terms of the message matters and what we've historically accomplished in Hawaii. In terms of when we think about smoke-free restaurants and what we have, Hawaii is a leader in that. And we didn't go around saying we're taking away your rights, but it's a matter of how we framed it. We framed it as we're protecting the health of our employees. I remember when you could go into an elevator and somebody would be smoking and no one talked about my rights about breathing clean air. But we started to talk about the rights of people who have no choice. They're going to work in the front line and they're going to be exposed to the cigarette smoke. And I think Hawaii has a culture where when we've tested messages, people are self-sacrificing, and people also will do something for the sake of someone they love and they care for. So I think it's a matter of how we message that and how we arrive at increasing the vaccination rates. I think an aggressive vaccination campaign is what we're working on right now with community-based organizations like We Are Oceania, Papa'ololakahi, Filipino PhilCom, it takes all of us, from the nonprofit organizations to the healthcare sector to the private sector and the business sector. I think it's just pushing as hard as we can with this campaign.
Marcus
So
and
in terms of,
Oh, sorry, Hilton,
so in ter-
I want to jump on that, and I think this will give you an entry to build on what she was just saying. Marcus and Makiki says, if we don't reach 70% vaccination, will we ever go back to normal with an auto lift of the restrictions? You know, in other words, what if we can't get there?
Well, in terms of herd immunity, we already have a level of herd immunity in Hawaii and across the nation. There's nothing magical about 60%, 70%, 80%. They are pure estimates as to when do you actually break that chain of transmission. The fact that we have well over 50% of our population vaccinated, we're getting close to 60%, means that we already have a reasonable level of herd immunity in the state. Now, the general consensus is that we need to get to about 70% to truly break to be much safer than what we are. And that's a good, acceptable level of herd immunity. Because of the variants, however, some people are suggesting that we should have 80 to 85% vaccination rates because of that adds a level of complexity, as Lola just mentioned. So the point is, we already know, based on the number of hospitalizations and number of infections, as of today, we had about just under 30, we had 33 patients, COVID patients in hospitals across the state. That's a long way from where we were at our peak when we had 300 COVID patients in our hospitals across the state in August and September of last year. So we have done incredibly well in terms of bringing that down. And when we look at the impact of vaccinations, in nursing homes, for example, the fact that we have over 80 to 90% of our residents and staff vaccinated in nursing homes, though that obviously, got past that herd immunity level, and we are having very, very small, or we might have someone who's unvaccinated, a staff member who's unvaccinated, one of the few ones that brings something, gets tested, and then it goes out and goes on quarantine for a couple of weeks. But we know that the herd immunity concept will work. We already have a level of it. The question is, how safe are we? General consensus would be right now, we're not where we need to be. And if we can get to that 70% level, that is a threshold that is widely accepted as truly breaking that chain of transmission and truly protecting our population.
Ron, we talked about employers mandating vaccines for employees, but what about businesses, private business, who might require a vaccination verification to enter a venue, for instance? David Lassner has talked about starting games up at UH, and they're looking at possibly doing some kind of a either rapid testing or vaccine verification for the fans. What are the, what grounds do businesses and private, entities have to mandate things like mask wearing when perhaps we reach the 70%, but a business still wants you to wear a mask indoors? How can you talk a little bit about that?
So the Civil Rights Act of 64-72 on the ADA has some new guidelines out on that, and they say, whereas before there was difficulty, you couldn't ask these kind of questions about the medical history of a particular individual very easily. But they say for COVID, you may ask them and get the information. And so if you do get that information, you have to store it separately, and there's some requirements. But nonetheless, the federal government through the EEOC, the ADA law says that you can ask those questions.
And you can deny entry, let's say, if I have a concert hall and I say only people who have verified vaccine can come to watch this concert. Can you do that?
So that's a different question. So I approached it from the employment relationship. Now, when you get into the public, it's a different question. But that example I gave you of the restaurant where 38 people got infected from a couple of people that hadn't been vaccinated, that speaks volumes to me. I'm in favor of that sort of restriction. I don't want to be sitting next to somebody who's not vaccinated. Although I've been vaccinated, I feel fairly safe. What if I bring a child or a grandma or somebody else who's not vaccinated? Or they spread it throughout you get another big set of infections. So it's a little trickier question when you're talking about telling the public what they can do in hospitals, essential workers, those people, in my mind, are fairly easy. When you get into public venues, and then restaurants might be easier because you got employees, but maybe you can require the ushers. But I don't know about your customers coming in. I think that's a little more iffy. I'm sure the lawyers would line up on that just to figure out what the right argument is.
Jessica, what can move the needle on this? What are your thoughts on the governor's incentive programs, giving out millions of miles, airline tickets, zippies for a year? Do those kinds of things actually motivate people, or would things like vaccine verification, needing for employment, let's say, is that a stronger incentive to try to convince people to actually get the shot?
I think honestly, if you want people to get vaccinated, the mandates from employers are going to be more effective. I honestly have some questions, or I'm not entirely sure that the incentive program that's been put forward, that's things like sweepstakes or zippies for a year, things like that, is really going to be that effective at moving the needle. I would love to be wrong about that. Because I would love to see that needle moved. But I think you have a couple of issues with things like those types of incentives. The first is that they really don't address the concerns that people have, that the sources of hesitancy. Saying you can win zippies for a year might be enough to nudge somebody who is, already wanting to do it, but just hasn't gotten around to it, to go get around to it. But for somebody who's genuinely unsure or who is more negatively inclined, the incentive of a prize is probably not going to get them to go and do something that they're not inclined to do. Perhaps more importantly, I also do have concerns that it sends kind of a troubling implicit message. Because oftentimes when we say, here we're gonna dangle this for you to do it's because we recognize it's something that people don't want to do. Because if it's something that is good in and of itself, the idea is people would do it without that added incentive, without you having to offer something to get them to do it. And so I do worry a little bit about something like this backfiring among communities who are already somewhat hesitant, who are, basically say, well, look, if the government has to put forth all of these incentives to get us to do it, then it must really be something problematic. I'm 100% positive that's nobody's intention, but I could see somebody who is already in that position of feeling hesitant and having concerns, sort of looking at this and having an incentive program, amplify that. And so I really do think that having things like requirements where, if you have something that you want to do, whether that's, attend school in person or have a certain kind of job that has certain kind of benefits or things like that having those attached to vaccination requirements is probably going to be more effective to get more people vaccinated.
So Lola, so I thought this was kind of innovative, all these incentives. And my impression is Hawaii is sort of a Las Vegas type of state, let's go for it and let's go to Las Vegas, let's gamble on this. So it'll bring people off their chairs perhaps, but I'm wondering if you or Hilton have, I thought I saw on TV show on the news that the incentive was producing a kick, an increase in percentage of vaccinations. Any truth to that?
We have actually and let me actually give the credit to Hilton and his group and the private sector.
Okay,
so the government is not funding any of these incentives. It's strictly from the private sector.
Okay.
And the government is providing the vaccinations and supporting the healthcare organizations who are setting up the vaccination sites. But yeah, we have seen certainly an uptick in interest, and the phones are off the hook in terms of people wanting to know about the hashtag I got vaccinated. Well, it'll be a few more days or a couple of weeks before we have all of the data to see if there's been an uptick in the vaccine.
I don't disagree, Jessica, with your ethical concerns, but I thought it was
Like I said, I would love to be wrong about about concerns about the incentives. I would really like to see those create a boost. I just from previous research also like within the social sciences on incentive programs and things like that, what we see is that generally they're offering an incentive, and particularly a fixed incentive, like rather than a sweepstakes or something that's effectively a lottery or a game of chance. If you know, for example, if you go, you get this reward, that can be effective, but it's usually effective for people who already want to do something. So they're effective in things like programs for smoking cessation. So if you already want to quit and then someone offers you this incentive, like it says, okay, you participate in this program, you get $100 if you do this program, or go through this and quit for a certain amount of time. Those are shown to be effective. But when we're talking in the case of COVID vaccines about trying to reach groups of people that aren't that excited about it, that have concerns, then I'm not sure it's going to be as effective among those groups of people. I think it could be a sort of a nudge for people who say, I want to do it, but just haven't gotten around to it. It's the other groups.
Well, Hilton, let's talk a little bit about that, about how many people that you think that will actually be moved by this and how much of a difference it could make.
We believe it will make a difference. I appreciate Lola making the distinction that there's no state or federal funds in this incentive program at all. It is done entirely by the goodwill of our community and our business partners. We're incredibly appreciative of all of the business partners that are participating. And when you think about it, who's participating? It's the airlines, it's the restaurants, it's businesses. They want us to be done with this vaccine, with this pandemic. They want people to be vaccinated. They want our communities to be safe. They want to be able to open up the restaurants. They want people to travel. They want people to go into businesses and congregate and go to clubs and bars and, and do all the things that we used to do freely before this pandemic had such an onerous impact on our society. So there are a lot of reasons that's been talked about as to why people not vaccinated yet. People in Hawaii, as Ron was saying, do like to prizes and incentives. They don't call the Vegas a ninth island for nothing. And whether, we know it's not going to influence everyone. It's not going to move everyone. But the fact is that there's a lot of publicity about it. There's a lot of people talking about the incentive campaign. And if that just causes people to do some people to do some research and say, I'll talk to their neighbors or talk to their friends or talk to their doctor about, well, should I get it? I'd like to get one of these prizes or be eligible for one of these prizes. And, if that causes just a few people to go out and become informed about the vaccine and make the decision to do it, then it's worthwhile. So we do believe we are, there is other businesses coming online, which we really appreciate. They want us to be safe in our community. They want the business to get back to our lives, to get back to normal. And so we are excited about this campaign. We do believe it will have an impact. The question is how much of an impact it's going to have and how soon can we get to that 70% figure.
Lola, there's some questions here, and I wanted to get to those. Joel and McCully says, can you clarify on herd immunity? How long will the shots protect us? Will we need one every year? Do we know that at this point?
No, we don't know that, but we are finding that with the people who were amongst the first to use the mRNA, that the vaccines are proving to be very efficacious. And so we may need a booster shot, but we may not. And so that's why this initial push is really, really important, because we have effective vaccines. And so in terms of going back to Jessica and Hilton and Ron's conversation too, I think if we're to look at the stages of change, we like to use social science theories, right? And so based on the recent survey and the study results that we got, I think it was about 68% of the people who participated in the survey said that they were vaccinated. So if we look at them, there were only about 10% that said they're not going to get vaccinated. So there's a lot of people in between, those who were also then scheduled already for their second dose, along with those who are still contemplating, but they're not saying no. So I think in terms of incentive program and that on the spot conversation and the decision pushed forward, nudged by the incentive, I think there's an opportunity. So yeah, the vaccines are very effective.
So if I can just add to the comments about the effectiveness, the primary reason we don't know how long they're effective for is because they haven't been out there long enough. They haven't been out there for over a year. The good news is that every month, and these vaccines and the people in the original trials are being tested every week and every month. And what we're finding is, as Lola just mentioned, the effectiveness or the efficacy rate of those vaccines is remaining very high. Now, there are concerns about the variants that are out there. The good news is that these vaccines are being tested against the variants and have generally performed very well against the known variants that are out there. It doesn't mean that they are effective against every variant, but they're certainly effective against a number of the dominant variants. So, and this is really good news that they are as effective for as long as they are, and they're as effective against as many of the variants as they are. Now, it is possible that booster shots will be required at some point in time, but again, as Lola just mentioned, we don't know yet. We do not know that. We don't know that yet, and it will take a while yet. And the rates, that we do know they're very effective for at least 9 months or so and counting. But every month we learn more about how long they're effective for.
And the U.S. did make the right decision in a 2-dose protocol, and that's proving to give us more of the defense system and the protection. So yes, the U.S. did make a good decision with mRNA and the 2-dose schedule.
Jessica, there's a question here from Dennis that I want to read and then sort of follow up on. And he says, please discuss and discount the crazy reasons why people don't want the vaccine. Rather than go through that, I think that what do you suggest? Because there is this element of peer pressure or just reaching out to those in your community. Perhaps one of the most effective way, we know that when people talk to their doctor, they can be convinced to take a vaccine, but perhaps when they talk to a friend or neighbor or family member, how do you approach those conversations so that you don't end up in a political argument, but that you're actually talking about the science itself? What are your recommendations for people who might be watching tonight?
That's a great question. I think a couple things. I think first, trusted, so to reiterate, trusted sources are really, really important if we're thinking about trying to persuade people or trying to move people towards, towards a position that they may not quite be in right now. And that's part of why, community outreach efforts are so important of coordinating with faith leaders and community leaders and things like that. Because for all people, public officials are not necessarily going to be that trusted source. It could be a neighbor, it could be a family member, it could be a community leader, it could be your pastor, right? And so that's, having people who are in the community who can have those one-on-one conversations and who are sort of invested in that person that they are talking to, I think is really important. I think another important element is to kind of try to enter those conversations with as open a mind as possible, and to listen and to not sort of judge and patronize. And that is 100%, easier said than done. Even the framing of a question like the one you read of can we just discount these crazy things and focus on the science? And for people who are very firmly pro-vaccine, that seems so straightforward and it seems so transparent. So why can't someone else understand if I just throw the facts at them? Shouldn't that be enough? But for people who are seeing things from a different perspective, right, who may have encountered and internalized some of the misinformation that's out there, or who just might be feeling doubt and just, they're just not sure. It's really important to meet them where they're at, to listen to their concerns, openly, to listen and to address those concerns in language that is accessible to them and is meaningful to them. And that can be language at a macro level in the sense of, having a conversation in someone's native language if they're not a native English speaker. Hearing things in your own language is different than hearing them in English or in a language that's not your own. But it can also be, meeting people where they are in terms of, the types of information they're ready to deal with and to process. It's a lot of newspaper articles and a lot of, academic discussions about these things. You see a lot of statistics. Not everybody's ready to, to kind of process a whole bunch of numbers or a whole bunch of percentages or things like that. And so, analogies that explain sort of how does the vaccine work, or why is it safe, or it's like this, individual stories that are, my friend got this, my neighbor got this, and, and see how they're doing and see the things they've now been able to visit their grandparents and kind of those sorts of things. Thinking about what's important to that person and trying to use that as an avenue in. But that starts with listening, right? That starts with having that conversation, meeting somebody where they're at and saying, okay, like, what's important to you? What are your concerns? And then addressing those genuinely, even if you yourself are entering this conversation knowing very strongly that you are pro-vaccine and you know the science and you know the answers, that you need to meet people kind of where they are at and help them from there.
Well, on that topic,
can I ask Jessica a follow-up?
Well, on that topic, I just want to get to John on Facebook. He wants to know, did everyone on the panel get their vaccine?
Yes.
I would assume so. Okay. We just have a few more minutes. Lola, I just want to get to you on this idea of the incentive programs that the governor had laid out. How will we know that they're working? When do we actually sort of take a test and know that they're actually having any impact?
Okay. Well, we are collecting the data every day and so in terms of when the data gets entered, we'll be able to see, and there's a lag time from all the different locales. I mean, in June, there are more than 400 sites providing vaccinations in varying sizes. And so as the data is gathered, we're looking at it on a daily basis. So we'll be able to tell in a few weeks if there's a bump up.
Okay. We only have a few minutes. Ron, I wanted to ask you one question, and you brought up this idea of people being able to sort of opt out of the vaccine if it is mandated for religious or various reasons. How easy or difficult is that to do, and how do you verify something like that? Can I just say that I don't believe in it for religious reasons, even though that may not be the case?
No. So here's a question between the law and discretion, or aloha. So they can raise all these issues, but as I said, and that may place a burden on the employer to reasonably accommodate them. But if they cannot reasonably accommodate that person's belief under Title VII, for example, without undue burden, then they don't have to accommodate them. They can look for alternatives, remote work, get a different job, whatever.
Okay.
Could I ask Jessica a real quick question?
Please go ahead.
There seemed to be, there's an elephant in the room, I think, on that last question about the crazies. And I don't want to give Youngji a lot of letters to the editor kind of thing. But so it seems like a lot of people, particularly in the South, in the southern states, and particularly Republicans, this is on national news kinds of stories, seems like they don't realize that Mr. Trump got his vaccinations, and they seem to hold out political reasons why they don't do it. Does that come up as you look at things?
I mean, I
didn't hear you say that. I didn't hear you give that as a reason.
No, I didn't. Yeah, I mean, I think it's unfortunate, but I mean, we all can recognize that this has become very politicized as an issue, and that is something that kind of pulls us away from the science. I think it is important to recognize that people's, what I would call social identities, basically the groups that they identify with. So it could be, identifying as a Republican or identifying as a conservative or identifying with a religious group or something like that, that social identities absolutely can and do affect how people communicate, affect people's beliefs, because they want to do things that are normative for their social group. They want to do the things that that other people in their social groups do, and so I think that is an important factor to consider. In some ways, though, that gets back a little bit to trusted sources, as if you can get somebody who is in that group and identifies with that group, to be somebody who can help be convincing, that's the ideal situation. Obviously, in this case, it can be difficult if a lot of people together don't want to get vaccinated.
And Jessica, I'm going to have to stop you there. Hilton, we just have about 20 seconds left. What's your final closing message to folks who may be on the fence tonight as we try to get more people to take the shot?
Find out, to get the information for yourself. There's a lot of information out there. There's a lot of people who have been vaccinated. It's been very safe. It's very effective. We all want to get back to normal. So let's do it.
Let's do it. All right, mahalo to you for joining us tonight. Of course, we thank our guest, Hilton Rathel, President and CEO of the Healthcare Association of Hawaii, Lola Hiroko Irvin, Administrator of Chronic Disease Prevention and Health Promotion at the Department of Health, University of Hawaii Associate Professor Jessica Kasorik, and UH Law Professor Ron Brown. Next week on Insights, a new pilot program to install red light cameras at several intersections on Oahu is set to launch this year. Officials say it's to enhance safety, but not everyone is on board with this. Please do join us then. I'm Yanji Denise for Insights on PBS Hawaii. Aloha.